Chair.
Thank you, Ms. Rice. Mr. Lamborn, you're recognized for 5 minutes.
Thank you, Mr. Chairman, and I appreciate your leadership in pursuing yet another scandal, basically. Here it is, June 1st. It's another month, and we've got another scandal. And it seems like the whole year has been like this, and I, for one, am getting sick and tired of it. Mr. Williamson, I'd like to ask you for some background in this whole issue. Whether we call the contracts illegal or just improper or non-compliant, what can go wrong when the VA doesn't follow the proper procedures as regards these contracts? Mr. Williamson.
You talked to me?
Yeah.
Oh, okay. I thought you were saying Mr. Giddens.
From a GAO perspective.
You know, I'm not a lawyer or a procurement expert either, and listening to what I've heard today from the VA witnesses, I'm a bit confused, because in one hand, they say there's no impetus or there's no reluctance to go to a FAR-based kind of process for purchase care for VA non-providers, and I think there obviously is, or otherwise Mr. FRYE would not have had the difficulty he's had. I think I would want to know what a FAR-based system would mean to accessible care for veterans, because the end game here is still providing high quality, accessible, and cost-effective care for veterans. And so if a remedy to solve the problem, if it's determined that a FAR-based system should be used here, the remedy I would want to know how long it would take in this process for a person for a contract to be executed, and what the process means. And I would want to know how it would affect the accessibility to care for veterans. Also, one thing we haven't mentioned yet is the whole idea of what it would mean for the acquisition workforce. When we did our clinical contract care work, we found that the contracting officers and the contracting officer representatives who do most of the legwork for the contracting officers are already stressed in terms of workload. If you increase that workload, you double it, tenfold, whatever it would mean to get a FAR-based system, then what would it mean in terms of the budget for hiring new people and so on? I just don't know what a FAR-based system would do in terms of accessibility and the workforce, and that's what we need to know.
Well, it's interesting. The GAO has identified 6 categories of problems that can arise when proper oversight is not provided by the VA. The type of provider care, credentialing and privileging, clinical practice standards, medical record documentation, business processes, and maybe the most important to me, access to care. So let me turn now to Mr. FRYE. Would you agree that those 6 areas are called into question when proper procedures are not followed?
Well, yeah, absolutely. And in addition to that, when federal contracts are required and you don't use them, there are terms and conditions that are completely missing from the contract. By federal statute, you're required to have terms and conditions. These include the termination for convenience, termination for default, the disputes clause, fair and reasonable price determination, just a whole host of issues, and probably even more important in terms of health care, the safety and efficacy terms and conditions that are required to be followed by these specific contractors. Without those contracts, without a contract, without those terms and conditions, the contractor is free to do what he or she wants.
Well, and that's my concern. And Ms. Anderson, in regards to your statement earlier, I have to agree with you. The government is obligated to pay for services that are rendered, even if the proper foundation wasn't, the procedures weren't followed in soliciting those services.
Thank you for the opportunity to respond to that. We were comparing a FAR-based contract and what it will take to become FAR compliant And then, to Mr. Williamson's point, to what end? Will that result in immediate care to the veteran? And I chaired a work group in July of 2014, and that work group was tasked with identifying measures and how do we become FAR compliant. We realized after 3-hour sessions over 4 months, 3-hour weekly sessions over 4 months, that there are lots of hurdles to overcome, not the least of which labor issues, consultation with labor, hiring a contracting officer workforce, estimate 600. Then it's like, how immediate can we really give the care at that point? Still, we need to go through the hurdles. So we quickly realized that we need to really begin aggressively pursuing legislation. And in aggressively pursuing legislation, we working with the Department of Labor, working with OMB, working with the Department of Justice, we've embedded in the legislation protections